based on your gram stain and based on your aerobic and your anaerobic action. The next point is going to be based on the Zeihl Nelson stain. Based on the Zeihl Nelson stain. Is it clear? Now, based on the Zeihl Nelson stain, you need to know that what the microorganisms are generally going to be the Mycobacterium family. And under the Mycobacterium family, the antibiotics that are generally going to be used there, we are going to have rifampicin and isoniazid. Rifampicin and isoniazid are the major antibiotics that are going to be used in the Zeihl Nelson stain family. Rifampicin and isoniazid, peculiarly rifampicin. Rifampicin is the most important one in the management of this infection with the Zeihl Nelson stain. That is why when you want to control the dosage of the antibiotics, you control with respect to rifampicin. Rifampicin is a major medication involved here. Now, after the Mycobacterium in the Zeihl Nelson stain, the next classification was the other classification. The other classification. Under the other classification, we had the intracellular microorganisms. Is it clear? For the intracellular microorganisms, the major thing that is going to target them are macrolides. Macrolide is a major antibiotic that is going to target those cells which are intracellular, as we have done according to the SchrDbb algorithm. We are going to use macrolides. Is it clear? An example of macrolides, we have erythromycin. We are going to have erythromycin, we have clarithromycin, and we have also azithromycin. So those are macrolides which can be used particularly when you want to treat intracellular microorganisms according to the SchrDbb algorithm. Now, the next one was other morphological cells. Is it clear? When you want to treat cholera, is it clear, which are comma shape, is it clear, you use and also I've forgotten to say that what apart in treating intracellular microorganisms with macrolide, you can also treat them with the tetracycline drugs. Is it clear? You can either use macrolide to treat intracellular microorganisms, or you can use also tetracyclines. An example of tetracycline is tetracycline itself, or you have doxycycline. Is it clear? So you can use both of them when you want to treat intracellular microorganisms that you have seen, like chlamydia, mycoplasma, pneumonia. You can use either macrolide or tetracyclines. Is it clear? But you need to know that the contraindication of tetracycline is that it should not be used under the age of 8 years, and it should not be used under pregnancy, because under the age of 8 years it can be is going to result to discoloration of the different bony structures, and when it is used in the case of pregnancy, it's going to result to teratogenic actions. So for cholera, instead, the major microorganism that is going to be used in that case, you still have tetracyclines. Is it clear? Tetracyclines that can be used in cholera. Is it clear? Tetracyclines can be used in cholera, or you have also macrolide, because cholera is going to act also on cells via an actions of intracellular microorganisms. These comma shaped cells are going to still act via an action of intracellular microorganisms. So these two major antibiotics can be used for cholera, macrolides, and we have also the tetracyclines family. The next one was for the Salmonella typhi. For the Salmonella typhi, they are going to be treated with, you can treat the Salmonella typhi, it is treated peculiarly with the third generation cephalosporins. It's treated with third generation cephalosporins, or it can be treated with penicillins. Is it clear? Third generation cephalosporins also with penicillins or macrolides. Is it clear? Those are the different things that can treat them. And we have also fluoroquinolones, which can treat them. And then for syphilis, the major drug that is going to treat it is going to be the penicillins. Is it clear? The penicillins are the major drugs that are going to treat syphilis. And for Helicobacter pylori, we have an association of antibiotics that is going to treat Helicobacter pylori. The first antibiotic in the quadruple therapy of Helicobacter pylori pylori, we have amoxicillin. The second antibiotic, we have the metronidazole, and then the third antibiotics we are going to have clarithromycin. Is it clear? So those are the three major antibiotics that are going to be given against Helicobacter pylori. After having those three major antibiotics, still when the patient has a peptic ulcer disease, you have to know that in addition to that, you have to give him a proton pump inhibitor. Particularly, you can give pantoprazole, you can give rameprazole, but omeprazole is the last proton pump inhibitor given in this case because it has the littlest action, but it's still given in a context because it's not expensive. Is it clear? So those are the different elements that you have to put in mind when you want to have the general antibiotics that you have to give in patient based on the classification according to the SchrDbb. Now the next thing after that, we have now the broad spectrum antibiotics. If you don't want to directly target only one class, you are not going to use the the antibiotics based on the SchrDbb algorithm classification, but you are going to give the broad spectrum antibiotics. So now the question is, what are the broad spectrum antibiotics that we have and that you can use when you have a multiple array of microorganisms involved?